baby's mom's breastfeeding. Okay, so for our breastfeeding moms, we really don't encourage the pacifier for the first month. The goal here is to get the baby to latch on. We don't want you to kind of miss those feeding cues. If you have something in the mouth all the time, you can't really tell sometimes when that baby's slapping or taking the tongue out and giving you a little hint that the baby is hungry. But we do know that the use of pacifiers can actually help reduce the risk of sudden infant death syndrome if later on you decide to use it. So that's something important for you to know. Very important, never fall asleep with your baby. Many of you are going to be sleep deprived, tired, exhausted, getting up in the middle of the night. Never fall asleep with your babies in the bed, sofa, or recliners. This is very important. We want to reduce smothering the baby by rolling over accidentally, or the baby rolling over and falling on the floor. And yes, we've had those incidents happen, and that's why we really want to make sure that our parents who are going home with their babies really start thinking about this. So what we're saying is, the baby can fall asleep on top of you, you can't fall asleep with the baby. So it's very easy to doze off with the baby, because you're going to be tired. And that's how we get these incidents.
We bought like, it's like this thing that you put in the bed.
The little travel, like snuggie thing. That
we thought that so we can have you sleep with us, or we probably shouldn't do that anyways.
Wait, is it a co-sleeper?
Bed? It's
like,
for the bed, like you have, like on the picture of the box, it has both
keeps
the
you
chairs.
from rolling over onto the baby.
yeah, it's got like
So it must be
walls
sturdy
around
enough.
Like a little
walls.
yeah, it's like
Yeah.
a little travel like
okay.
bassinet.
Well, ask your pediatrician.
Yeah, pediatrician
I
definitely.
wish I learned stuff too, see, because I like to do it, there's a support group I like to do, and I always learn stuff. Products, I want to like look that up, we gotta write that down.
Yeah,
Yeah,
it's a
different
co-sleeper, but it's a
kinds.
sturdy type of side, right?
Yeah.
Yeah.
And it's got like walls, and it's got netting so you can see through it, but it's got like
It's
sturdy
good to have your baby
It's
close to
netted,
you.
it's not fabric.
Yeah.
You know what I mean? It doesn't have that bedding like you were talking about.
Yeah.
Because
Yeah,
there
it's
was
really
another
good.
one that did have it, and that's why we were like, you know.
Mention it to your pediatrician too. I think that would be a good
Maybe
discussion for
bring
your
it in.
pediatrician. If you want to, I think that would be
Or
good.
maybe the ad for it,
Yeah.
or the online.
Okay.
To take care of yourselves when you go home. Julie would talk about mommy care at the end, but I want to also talk about your baby and how your baby communicates with you. And the only way to communicate, bless you, with
like
you is by crying.
By sneeze?
But it was you for a second.
Your baby's job is to cry. It's the only way it's going to communicate with you. So this is really important. It's very normal to feel nervous, feel overwhelmed, to feel stressed out, or even to get to the point where you're feeling a little frustrated. There's nothing wrong with you. All parents experience this. Sometimes what we tell parents is keep trying different things. Is my baby too hot or too cold? Do I need to maybe hold my baby? Maybe your baby just wants to be nurtured. Or I want to check to see if the baby's pooped or urined. Feeding the baby. Try burping the baby. Try standing up with your baby and just going side to side like this. It just kind of reminds the baby of when your baby was inside and you were walking. Try putting your baby maybe in this area here, in your neck area. That swooshing kind of noise in your veins reminds them of when they were inside. So you keep trying different things with your baby. And if you get to the point where you're home and you're by yourself, and you did everything on the list that we've asked you to do, and you're just getting to that escalation where you're just feeling just really frustrated, you do need a plan in place. And part of that plan is going to be, you're going to swaddle your baby, and you're going to place your baby in a safe place like a crib or bassinet, and we're going to let the baby cry. Stretch it out to 5-10 minutes, 10 minutes if you need to. And that's the time to let yourself remove yourself, go to a different room in the house, take a deep breath. Okay? Try to de-escalate some of those emotions. Because you're going to be feeling a little overwhelmed. Take a deep breath. Focus on yourself. How do I get myself to calm down before I can then go back and deal with my baby? This is really, really important. Every parent in here needs a good plan in place. Even our babysitters, like our auntie over here, or our grandparents, we all need a little time out when we're at our wits' end. One of the things that we want to reduce is the shaken baby syndrome. It's when that person doesn't have a good plan in place, just instead of removing themselves, they keep getting themselves even more frustrated. They pick up the child and they shake the child in this motion. So it's kind of like the head wobbling back and forth forcefully, which causes some trauma to the head. So it's really important for some of you, I think all of you are first timers is what I heard earlier this morning, really important to get involved with some support. We have parenting groups we've offered you today. We've offered you a telephone support programs and even our in-home support program. So we've got a wealth of resources, and we really are hoping that all of you sign up for something because that will give you more support after you leave the hospital. Some of our moms or dads go back to work, and there's always one parent that may stay for a couple of months with the baby. And sometimes our parents do become a little isolated when they're home and there's not a lot of family or friends available. So we do appreciate all the grandparents that are here and the aunt who came by, because families do need support, especially when they go home with their new babies. Okay. The last thing I want to talk about is how do we prevent other accidents with babies. One thing that I recommend is when you're going to change your baby's diaper, we made it too easy for you. If you look down here, we got everything you need. But when you go home, go to the area first for everything you need. And when you have everything in extra, then you get the baby and you bring the baby over. This is how you're going to reduce the incidence of a baby rolling over, because you're not prepared, or you get there with the baby and you don't have enough supplies. And what happens is we tend to multitask. We're trying to figure it all out, holding the baby from one hand and just turning and leaving that baby for a second. That baby can roll over and we can see a head trauma. So we really want to reduce the incidence of babies falling. Same thing when you're going to bathe your baby. There's so much to do and prepare for. You want to get everything ready to go, that water going, everything you need. Then you go undress the baby, wrap that baby in that towel. And Julie will talk more about bath time with babies as well. Does anybody have pets at home? Dogs, pets, yeah?
Cat.
A cat. So basically what we usually recommend to our parents is if you can send something home, if you get a chance, a little hat, something that the baby has worn here, get that animal to sniff and know that something new is coming home. Cats are really smart, so they probably know there's something new coming home because they probably knew, they were very close to mom. One thing that we do recommend is just be careful when you put your babies in the car seat. Sometimes we tend to go visit folks and we put the car seat on the little coffee table, and if you have any dogs or any other pets, they tend to jump up and they push the car seat. So another good safety tip, and I would never leave the child alone in the same room with a pet. No matter how nice our pets are, they tend to jump, scratch, do all kinds of things. And if there are any siblings, little cousins coming by, I usually say 6 years or younger. I would not leave that child alone with the baby, because no matter how nice these kids are, they tend to get a little jealous, or they want to be maybe helpers, and we've had them pick up the baby and drop the baby, or the poking of the eyes, all kinds of little
Put stuff in their mouth.
things.
Like,
Yeah, ears, all kinds of stuff we've heard. So just something to be aware of with when you have other little ones in the house as well. Okay.